Welcome back, everybody, to the interviews with veterinarians, naturopaths, pet parents, and people all around the world about using their pets' vitality and balance to keep them healthy, have the best quality of life for as long as they can have. And today, it's my honor to be here with Jamie Oskin. Is it Oskins?
Yep.
Who's a naturopathic physician in Arizona. And today we're going to talk a little bit about Dr. Oskin's conception of vitality balance and what we can do to help our pets stay healthy. So welcome, Jamie. Thanks so much for coming.
Thanks for having me.
It's our pleasure and honor. So why don't we start with what do you think of when I say vitality?
You know, when I think of vitality, I think of kind of like this inner balance and harmony in a person or a pet. And when things are kind of in balance, everything's good. When things are out of balance, that's when there's a problem. And you can almost think about it like the economy. You can't necessarily see internally. You can't see someone's vitality or what's going on the inside, but you can see the effects of it. You can see if the Dow Jones goes up or if the housing market crashes. So you see the symptoms of the economy, but there's no real thing of the economy because the economy is a function, right? Same thing is true with love, right? If I said, show me the love, you can't really see love, right? But you could see the expressions of love. You could see if somebody flushes in their face when they see someone that they care about, or if their heart starts beating, or right. But love itself is a function, and vitality is also a function. It's a function of balance in an organism, whether it's a pet or a human. And when things are in balance, then things are in harmony. And when they're in harmony, the good news is that we all can kind of live our greater purpose, whether that's an animal or a human. If we're not well and we're not in balance and don't have our health, we can't live up to our highest ideals of fulfillment of life because we don't have all our juice, so to speak.
So the vitality is kind of like the juice, kind of like the gas in the car that lets us live our lives. And when we're balanced, when our vitality is balanced, we're able to live the best lives that we're able to live.
Absolutely.
Is that what you meant? Yeah. So you equated vitality balance and kind of the ability to live your best life. But you interposed in there, you said something about, the effects of being in balance or being out of balance. So physically, can you give me other examples? I mean, you gave the example of the blushing with the, when you're in love, but, can you give any other physical examples, of what you would consider balance or imbalance in people or pets?
I think about my dog, who's actually here with us today. Should I show everybody?
Sure, of course.
She's at the office with me today.
Hi,
that's
baby.
Colby.
Hi, Colby.
Anyhow, so when I think about if she gets sick with, let's say, a diarrheal illness, and she doesn't want to eat, and she's not acting like herself, something's not at her best. When she's healthy, like today, I said to her, do you want to go to the office? And she just jumped up, and you could see like this smile on her face and this wagging of her tail, and she ran over to me, and she knows what that means. She knows that means today she's not chasing birds and squirrels in the backyard, but that she gets to go to the office and maybe see some of the other dogs in the office complex, and so she has that. But if she's sick, she's not kind of living her fullest life, because she might, she's got the diarrhea, but she's also not her normal self. She might be laying in her bed and not wanting to play or interact with us. She may not even be excited about going on a walk or something that normally would be really exciting for her, because she can't live her fullest life when she's not feeling well. And so the physical manifestation would be the diarrhea, but the kind of greater purpose and meaning in life, whatever we can say that is for a pet, is not being fulfilled.
So you equated balance and symptoms. So I know it's a bit of a stretch here, but can you tell me physiologically, is that something that when you're imbalanced, you have symptoms, or is there a relation between balance and symptoms? I mean,
Yeah, it's a great question. I mean, I think a lot of times we can't really see what's going on inside. Of course, now with modern medicine, we know a lot of stuff's happening inside, but we can't necessarily see it. But we can see the symptoms. So if somebody gets a viral illness, like a respiratory illness, let's say, which seems to be common these days, uh, the person could get a fever and maybe chills and muscles aches and a cough. And we could see those things on the outside. Now, with modern medicine, we could actually look on the inside with lab values or imaging, and we could actually see the changes inside with these things like cytokines and heat shock proteins and all those things that we think cause the fever, and the chemical imbalances and changes internally that are related to the illness. But we can't necessarily see that on the outside. It's kind of like the economy. We can't really see the economy, but we can see the Dow Jones going up and down, or we can see interest rates on your mortgage going up or down. That.
so you opened a big can of worms. So I'll have to ask you: what do you consider in your practice to be more important? The virus that's causing the viral infections you mentioned, or balance?
I think they're interrelated. I think it somewhat is a little of both. If there is a virus that's so virulent like Ebola that is dangerous to just about anybody, then that's problematic to anyone who comes in contact with it. But for more average things like the flu and common colds or that kind of thing, a lot of it has to do with how well balanced the person or the animal is, right? If and a really good example of this, without getting political, is the current pandemic we're in, right? We know who this pandemic affects in terms of humans, right? It's affecting people who are at high risk. And who's at high risk? It's people who are obese, they have high blood pressure, high cholesterol, heart disease, maybe lung disease because they were a smoker and they have COPD. It almost is like a non-existent disease in children in terms of severity. It's not too different from any other cold that they would get in the course of a typical school year, unless they have like a really serious lung disease like cystic fibrosis, right? So there are certain people who are very susceptible because of something that's going on in their health, but we can actually identify and predict that. And it's not too different with most illnesses, right? The people who tend to be the most susceptible, or the animals that are most susceptible, are those that are frail for some other reason. They have some other reason to be sick. They're elderly, or their immune system is compromised, or they're just not well. They're overweight. It's one of the reasons I jog my dog every day and kind of keep her weight in check. And I personally, that's part of my health journey, becoming a naturopathic doctor, is I was probably about 50 pounds heavier and pre-diabetic in my 20s. And it was getting my lifestyle with nutrition and exercise on track that helped me regain my health, reverse the pre-diabetes, and that led to a passion to go back to medical school. And so, one of the things we keep thinking about in this current situation is that it's all about the bug, and we have to fear the bug and live in lockdown. And, a counter narrative to that is, I think obviously this is a dangerous situation, and people who are at high risk should be very careful, right? There are, if we don't treat this virus with honor and respect, it will harm somebody we care about and love about. And we have to recognize that it is serious to certain people, but we can identify those people and, first of all, protect them. But second of all, we should be having a Let's Get Healthy campaign, because we know, right? We know that within days to weeks of getting healthy, the immune system changes dramatically. And I'll give you a couple examples. I have two patients who have gotten sick during this pandemic with verified lab tested positive tests, and both were high risk, obese, diabetes, high blood pressure, all the things that should put them at very high risk of going into the hospital. And yet, because they've been our patients, where we help them modify their health, they're already doing things like sleeping and eating healthy and exercising. And so their underlying high risk factors were already reversing. And so they got sick, and yeah, were they really sick? Yes, they were. But did they recover just fine without going into the hospital? Yes. And, one of those women told me, she said, "Dr. Oskin, if I wasn't working to get healthy, I really think I'd be dead right now, because just the things we do, the food we put in our mouths, the exercise we get, can literally change our internal biochemistry and risk factors within days to weeks." And, it's one of the reasons I feel guilty if I don't get up at 5:45 every morning and take my dog on a jog, because in some senses, like, I know I need the exercise, but I feel guilty if my pet isn't getting that exercise to take care of her health.
Wow, awesome. Thank you. So you kind of answered this already, but I was going to ask you about the components of parts of your get healthy lifestyle. Is diet, exercise,
Yeah, I mean, diet, exercise, sleep, stress reduction.
sleep, stress
Um,
reduction.
all those things play a role, because certainly our immune system is compromised under high stress. We know people who are victims of trauma have higher risks of early death, higher risks of autoimmune disease, higher risk of infection. And a lot of our animals, like my puppy that you just saw, well, she's not a puppy anymore, she's a grown lady, but she was a rescue, and she was highly traumatized when we got her. We've done a lot of work to help her get emotionally more healthy. And that plays a big role in our immune system too. We know for a fact that literally when people are depressed, their immune system is depressed. If a doggy is unhappy or traumatized, their immune system is depressed. We know that within hours of a high sugar meal, the immune system goes down. We know they did these tests on college kids. So with humans, I'm a human doctor, but I know that many of you watching are interested in learning about pets. But when they did these, a lot of tests they do on college students, because they're cheap and willing participants to get $20 or whatever to participate in a study. Well, they did these studies with the common cold, with the virus for the common cold, and they actually had the volunteers shoot the virus into their nose. I don't know who would sign up for this kind of study, but but there were two groups. One of the groups had been getting 8 hours of sleep, and the other group only 6 hours of sleep. And the ones who got 8 hours of sleep were dramatically less susceptible to the common cold. And it was something like 50% more of the people who only had 6 hours night sleep the night before actually caught the cold and developed symptoms. So these are basic tenets of health, basic lifestyle factors: stress reduction, adequate sleep, eating healthy, exercise, environmental things, making sure we have pure water and good sunshine, and making sure that the basic foundations of health are there can go a long way in terms of our susceptibility to getting sick.
So what do you mean by susceptibility to getting sick? I mean,
Yeah, well, what I mean is that, there's always to every illness, there's always nature and nurture, right? And some of it is when I say lifestyle and taking care of our stress and all that, that's on the nurture side. Are we nurturing ourselves to be healthy? And the nature side of things would be like, well, how bad is the bug? How bad is that uh, virulent? How virulent is that bacteria or virus? How dangerous, I should say, is a better word. And many of you may have kids, or maybe you had kids and they're grown now. But you could think about, let's say you have a child in a kindergarten class, and that child goes into their kindergarten class, and one of the children tests positive for strep throat. There's a bug that is kind of, a fairly bad bug that can cause strep throat, right? Well, all the kids get exposed because they're all sharing the same toys and they're all sharing snot and they're all close to each other, but only some of the kids get sick, right? Well, that's what I mean by susceptibility. Did that child, was their nutrition poor, or was their microbiome off, and the bacteria in their throat make them more susceptible? Had they eaten a high sugar meal for breakfast because they had Pop-Tarts and sugar juice, a Capri Sun or something? What are these things that made them more likely to have their defenses down, so that when the invader came in, the army, the immune system's army, wasn't ready to fight?
so I take it that you would not be in favor of those kids eating Cheerios or any other dry processed food day in and day out. You think that might affect their susceptibility to getting sick?
Absolutely, absolutely. And so processed foods are not good for humans. And I'm not a vet, so I can't say, but my guess is that pets who eat a natural diet that's meant for them are also probably overall healthier than those who eat a highly processed diet.
Fantastic. Well, that's great. I just have one last question, because you're an naturopath, and I know you guys are focusing a lot on cellular energy and mitochondria and ATP and all the good stuff that lets our cells and our pets and people work
Mhm.
properly. Do you have any feeling for a connection between that cellular energy and symptoms and balance?
Sure. Yeah, I mean, there's an emerging area of research um, looking at this. The guy's name is Navarro, I think, is one of the real popular guys in this area for any nerds who want to look that up. But basically, what they're finding is a huge relationship. When people are chronically ill, there's a breakdown at the cellular level, and it's like the machinery inside the cells, the little um, the workhorses inside the cells aren't working properly. And so if all the gears are jammed up and they're not working properly, think about a condition like chronic fatigue syndrome, that somebody gets after mononucleosis, right? So they get mono, and then they develop chronic fatigue, and they just never get better after being sick. They get sick once and never recover. Well, in what we now know is inside the cells, it's like all the machinery is gummed up and it's not making energy properly. And we need those, what you were talking about is these things called mitochondria, which are like the workhorses in the cells that make these things called ATP, which you may remember from high school biology. But basically ATP is the, it's the energy source for our body. We get all the energy in our body from that. So if we're sick and all the little factories in our cell are all gummed up and not working, it's no wonder that we feel fatigued and we feel muscle aches and we maybe get headaches or whatever symptoms we get, because we're just not functioning properly, the cells literally can't do their job. And what we have to do is clean up the house and make things better so that the factory can start working properly again, and so we can start functioning and optimally and feeling better.
Now, are you aware of any work that's been done between the balance that you mentioned and that energy production, a direct correlation?
Yeah, sure. I mean, I think there's a lot of areas in natural medicine that have shown the most promise. I think that's because whole system um, healing methodologies seem to be having a bigger effect on these things. It would, isolated drugs that are reductionistic to one chemical reaction don't seem to work holistically. And that's because if you look at something in the cell, there's a lot of different functions going on, right? There's um, a lot of different chemical reactions going on. And so if all you do is target that with one drug, you're not going to affect the system holistically. But if you can use a therapy to stimulate whole person healing, you're going to have a broader effect on the organism as a whole.
Oh, well, that is, I guess, the quintessence of holistic medicine with the W, holistic, the way it should be spelled, I guess. Well, that was awesome. Let me just recap because you went into a lot of great detail. Vitality is energy. It's the energy, it's the cellular energy that our bodies and our pets' bodies need to work. And when that energy is waning or imbalanced, then you see physical symptoms either on the outside or the inside.
Mm-hmm.
The ones that are able to be seen or the ones that have to be tested, and that you can optimize that energy with the healthy lifestyle, which makes you less susceptible, more resistant to getting a bug. Is that is that right?
Absolutely. Healthy lifestyle, and then, certain natural therapies that can actually help stimulate the body to be healthier as a whole.
Great, awesome. Well, thank you so much. I really appreciate your time. And like, gosh, I'm one of those nerds that you mentioned, so I'm gonna get off and go look up the research that you mentioned. So thank you, thank you, thank you, and we will talk soon. So bye bye, everyone. Thank you.